So, as stated early on in my slides, the purpose of a newborn assessment is to detect abnormalities or illnesses as soon as possible to give children the help they need as early as possible. Here's my makeshift baby. His name is Snowy. And this is my makeshift baby scale. And here is the cloth I will be putting on the scale to make sure that the baby isn't cold when I place the baby on the scale. And here's my disposable measuring tape. So first to measure the weight, I would place a proper cloth, not a napkin necessarily, but that's in the right circumstances, on the scale, on the baby scale. And then I would place the baby on the scale. I'd wait a few seconds until the measurement shows up on the scale, which should be in grams for accuracy, and then I would convert it to pounds and ounces for the parents. I would then plot it right here on the newborn graph as I have done, but because Snowy's a stuffed animal, he doesn't even weigh a pound. He was a few ounces, so I can't really plot it on the newborn graph, and that would be a huge sign that something is really off, because that's not in the margins, that's not in the healthy margins. So that would be something to take note of and, you know, address as soon as possible, which is the purpose of the newborn graph. So, and the babies should weigh typically between 5 to 8 pounds at birth. 5 to 8 pounds, and sometimes there can be variations of what's expected due to gender, race, DNA. So, and that's for everything I'll discuss: head circumference, abdominal circumference, everything. So I'm just stating what's expected, but it's not necessarily ideal in every case. Okay, and so what's next, I'll actually just leave this here, is length. So when measuring a baby's length, you want to make sure that you measure from crown to heel, and sometimes the baby's legs may be, you can't see Snowy too well, sometimes the baby's legs may be a little scrunched up. So what you do is straighten the baby's legs, or hold the baby's legs straight, and you then measure the baby by measuring tape. Okay, so here we go. Measure from crown to heel, and for Snowy that's about 17 inches. Snowy's actually not too bad, because the typical length for babies, newborns, is from 18 to 22 inches. So Snowy's not too far off when it comes to length. And as I stated in the beginning of the video, the baby would typically be measured with a disposable measuring tape, so you just toss it out right after you measure the baby. Next is the baby's head circumference. So I would put the measuring tape just above the baby's ears, around the occipital bulge, and I would measure, and Snowy is about 14 inches, which isn't too far off from the typical measurement of a newborn's head circumference. Something to be noted is that you want to measure the baby's head circumference like 1 to 2 days after birth, after the molding of the head has resolved. And the molding of the head happens because of the baby going through the vaginal canal. So after 1 to 2 days, that should be resolved, and you should get an accurate measurement of the baby's head circumference. So up next is chest circumference. The chest circumference should be measured around the nipple line, And for Snowy, his chest circumference is around 16 inches. Notably, the chest circumference is typically 2 to 3 inches smaller than the cranial circumference, though this may vary at times because even after 1 to 2 days, the cranial molding may still be there. So, I mean, but 2 to 3 inches smaller is what's typically expected. Up next, you would do the abdominal circumference, and that would go right around the umbilicus, and it should be around 24, typically around 24 inches, but again, that can vary because of gender, race, DNA, you know, so, but it's just what's typically expected of newborns. Other things to visualize are the trunk. So the trunk, how to visualize the trunk. So you would visualize the trunk by palpating the clavicle. And if you notice that the baby keeps one arm to the side, you would take note of that, and that can signify a fracture in the clavicle. I'll try to show you. So here we go. If you palpate the collarbone and only this arm moves, then that could signify a fracture in the clavicle. Or if you try to move the arm that's not moving and the baby cries, then that could definitely signify a fracture in the collarbone. If you notice this, you take note of it and that the doctors know, and then they would perform tests to properly diagnose the fracture, and then that should heal up within the first few weeks. Okay, so last but not least would be the nipples. You palpate the nipples for size, and the size determines the baby's gestational age, which is something you take a note of as well. Something I learned about that I think is really cool is that when you palpate the nipples for size, the baby may exude breast milk, and this is completely normal due to maternal hormones from the mom. This breast milk is called witch's milk. Something else to note is that the nipple size and the trunk, these are not measurements that the things that you visualize are not measurements that you would plot on the newborn graph, as they're not exact measurements. They're just, you know, like quantity measurements, like weight or length. So these are just things you take a note of and leave with the newborn graph. And the next time that you see the patient, the baby, you can remember what happened the last time and, you know, check for progress.